Yep.
They're like that.
And I'd be in this position if my back was like this right now.
So this is L5 and this is L4, your bottom two vertebrae and your low back. The disc, and this is where most herniated discs happen.
Mm-hmm.
And so if you bend forward like that, this is the mechanics that happens. Now, what happens if you have a weak disc from whatever the problem may
From
be?
repetitive use.
Usually that's it.
You can do that. Look at that. Watch it bulge right out or herniate right out. And then there's a nerve right back there that it could, bulge up against and cause pain down your leg.
Exactly. And that's the sciatica. So if we can do some exercises that allow this to go back into where it's supposed to go, and then keep it there and allow scar tissue to heal over that bulge area so it doesn't come out anymore, that's the goal.
Right. And let's just say this, Brad, that, on a normal healthy disc, you can bend forward like this.
Oh, right. It's not a big...
That's just going to happen. But if you do it repetitively over time and with weight,
yes,
then you're putting stress on that disc.
In other words, you're lifting up...
Right. You're putting
hay bales or whatever work you do.
With your back rounded out like this, not in a good spinal mechanics. Yeah, right. So what happens? How can it heal, Brad? I thought maybe we'd show this, Brad.
Oh, sure.
So, this is the part that's bulging out. Well, one thing, this disc material can sometimes get reabsorbed right into the body, right into the other disc.
Right.
The other thing, the disc material might dehydrate and it no longer causes problems. The water comes out of it.
Sure.
Desiccates. What is that? What are they? No, that's when it deteriorates. But the water goes out of it. So dehydrates. All right. Also, in response to inflammation, the body creates little microphages, which I like to call like little Pac-Man cells.
Sure.
Are we dating ourselves when we say that? Do people know what a Pac-Man cell is?
If you're over 50, you do.
Yeah, that little game where the thing would go around.
Yes.
Even Liz knows that.
She's only 29 or something.
We don't say her age.
21.
So, all right. So anyway, that little macrophages can come in there and they'll eat the disc material. Isn't the body a wonderful thing, Brad?
Well, on my X-rays, I don't even have a disc between L4 and L5, and I know that's exactly what happened because it just didn't disappear. It took time. This doesn't happen in a couple of weeks.
Right.
This is something that may take months.
It may, but to be honest with you, I'll talk about that in just a minute. But the last thing you can do is if you do McKenzie exercises, McKenzi, type in Bob and Brad McKenzie, and we're going to show you all sorts of exercises that you can do for the disc problem.
And McKenzie's a